All right, we are back, and we are back with Dr. David Lubarsky, MD, MB. Dr. Lubarsky is the Chief Executive Officer of UHealth Physicians Practice. In this role, he coordinates and oversees the daily provision of care by the 1,100 physicians in the University of Miami Medical Group, the largest practice in the state of Florida, and one of the largest in the country. He holds the title of Emmanuel M. Papier Professor of and Chairman of the Department of Anesthesiology, Preoperative Medicine and Pain Management at the University of Miami Miller School of Medicine, and oversees the largest anesthesia training program in the world with 137 interns, residents, and fellows. Welcome to the program, Dr. David Lubarsky, and if I'm hurt, please make the hurt go away.
We can do that.
All right.
No problem.
All right. Well, listen, I just want to thank you for coming on the show today, and I want to make sure that we get to the important things. What's it like running a healthcare organization that's got 1,100 doctors?
Well, you know, it's a challenge, obviously. You may not realize how big that really is, 1,100 doctors, because every one of them is actually truly an expert and someone who really knows what they're doing. And I like to think of it rather than running 1,100 doctors, that I go to work every day thinking about how I'm working for each one of those 1,100 doctors to make them more successful. So that, to me, is what my job really is, because I don't need to run them. They run themselves. What I need to do is organize our job place so that they get what they need to be the great physician they are.
Wow. I want to work for you. Now tell us a little bit about the healthcare system in the United States and what you see happening in the next few years. I guess that's really a play on what's going on in D.C., Doc.
Yeah, you know, that's a very exciting time, I will tell you. This whole thing around accountable care organizations, which people don't really understand, but basically it's a bunch of doctors and hospitals getting together and deciding how they're going to take care of people for less money by coordinating things extremely well. And that's a really laudable goal. You don't need the government to tell you to do that, but what the government did do is aligned incentives so that we would get around to doing it, because medicine is traditionally a little bit slow in changing.
So what's going on with the Supreme Court? It seems to me that they're talking about the independent mandate, the this and the that, but there's been such a mobilization already in the healthcare industry that to repeal it might cost more money than to let it go?
I don't know. I don't think it's going to cost more money than letting it go, but I really believe, based on what I've heard in the oral arguments, that the Supreme Court will not allow the individual mandate to buy insurance to go forward. And if they do decide that that cannot go forward, the whole bill will fall flat, because so many of the provisions depend on everybody having insurance.
Yeah, there's no doubt about that. And I know that everybody has the ability to get their health care done if they show up in an emergency room. That just means that we all pay for it if they can't, and that increases health care costs. And with the amount of uninsured here in South Florida, we have very high health care costs here because of that. That's
exactly right. And this actually would have helped not only South Florida, but most specifically our partner, Jackson Memorial Hospital, would have been tremendously helped, because so many of the people there who don't have insurance would now have been covered, and we would have been able to provide better care for the poor.
Now hold on a minute. You just referred to Jackson Memorial Hospital as your partner. That sounds terrific. Sounds good.
Yeah, I know. You know, that's not necessarily what you read all the time, say in the Miami Herald or
right.
Europe, but in point of fact, they are our partner. We are inextricably linked. Our training programs are done in partnership with them. We turn out the vast majority of new physicians in the state of Florida. Your physician, who you're seeing, no doubt, was probably trained by us in that hospital that provides such a great clinical setting. And we are working with them very, very hard to continue to keep the level of the training programs high, and the care that we provide the less fortunate as high as well.
Well, I always think that we're judged on how we treat the weakest link in our society, so kudos to you and the doctors at UHealth.
Thank you. They're really dedicated to that.
Now let's talk a little bit about UHealth. That's the University of Miami Health System. On our show we refer to it as UHealth. And let's specifically talk about the growth over the past 2 years and the vision of Dean Pascal Goldschmidt to make UHealth one of the top health systems in the world. And there's a little secret out there. You preceded him down here from Duke, didn't you?
I did. I got here about 5 years before he did, but I met him, knew him well at Duke, and before either of us were chairs of departments. And he was a great and brilliant researcher, scientist, and clinician, and he still is, but now he's a great leader of an exponentially exploding healthcare system. I mean, it's really unbelievable. We've doubled in size in the last few years.
Wow.
And in a time when most healthcare systems are contracting.
Yeah, that's what I've heard, and it seems to me that he's a visionary because he not only wants to make UHealth the preeminent healthcare facility here in South Florida, but I believe that what he also wants to do is export the best of service and best in class to other organizations and other systems throughout the country and throughout the world, and it's such a great goal.
Yeah, we do have a vision of leading the way in healthcare here, and just to give you an idea about this, the whole idea of ACOs and the government pushing us to do this type of thing.
ACOs.
Accountable care organizations.
Thank you.
In the Obamacare bill about how you get physicians and hospitals to work together. What a lot of people in South Florida may not realize is we already have a fully integrated healthcare system at the University of Miami. The hospitals, specialty hospitals, general type hospitals, clinics, doctors, nurses, we all work together as a single unit, and that's making that integration entirely seamless and transparent to the patient so they get everything they need without even having to think about it. That's part of what my job is.
And I must tell you, thank you from my wife.
You're welcome.
She's over at like I said, at Bascom Palmer, and she had bone density test a couple of days ago. They're just doing a whole workup on everything with her, and I must tell you, and this is, we're on the air, whatever, you can't see, well, I guess you could see it on the website when we put it up. Thank you so much for everything.
You're very welcome. You may not also realize this, is that the physicians at the University of Miami, routinely, we do anonymous surveys and benchmark ourselves to national polls. We're routinely ranked in the 95th to 99th percentile. That is at the very top of the nation for our patients recommending our physicians. It's pretty amazing because we're a gigantic place. We see more than 1.2 million patient visits a year, and yet, despite that volume, and despite being located in the middle of the city, which is a little hard to get to sometimes, the amount of great care that's delivered by our physicians is unequaled across the nation. And
I want to correct a misnomer. It's not tough to get there. You're at the crossroads of South Florida. You
Good
really
point.
are. You really
836,
are.
95.
That's right.
Not hard.
Not
it's
hard.
Very visible. It's like a mini city in and of itself.
You got the train station there, and I got to tell you, is that no matter how much they build at all these other biotech things north of here, they'll never get to the physical plant and the quality of staff that you have. It would take them generations.
Generations. You know, that's very interesting you bring that up, because some people think that, oh, there's a new medical school opening up or there's a new hospital opening up. And we're all for that, and we're very supportive of that. But it's taken us half a century to build the expertise and the depth and the great physician core and the training programs. These things take a long time to put together.
It takes a long time to discuss too, and we're almost out of time, and I want to make sure that we have you back because there's so many other questions that we want to talk about the business of healthcare with you. Before we go, if somebody wants to get some direct information or is interested in joining the staff and the team, how do they get a hold of you? How do they do that if we have some quality physicians that would like to join your team?
Okay, so that's really easy. It's my last name, Lubarsky, Lubarsky, at miami.edu. And if you're a patient seeking the very best health care in Florida, you can reach any one of our 1,100 physicians and make an appointment at 305-243-4000 for your health. 243-4000.
Wow, that's just terrific. I want to thank so much Dr. Lubarsky for being here on the show and talking to us about the business of healthcare. I want to thank the University of Miami healthcare system. We call them UHealth here on the show for being a sponsor and helping us bring all this good material to our listening audience. Next week, we're going to have a great representative from UHealth on talking about stem cell research and regenerating your heart and stuff. So make sure you listen in. Again, thanks to UHealth. We'll be right back after this short break with Victor Franks and Lolly Green.
That's great, man. Thank you.
Had a great time.
Yeah,
all right.
Well done.
Good
awesome.
job, man.
You're
awesome.
Doc.
Nice, Doc. We talk about death penalty sometime too. I don't know if you know that, but I didn't mention that I've actually been on a bunch of TV shows and stuff.